Welcome back. Leanne Holmes is with us to continue our discussion on the impact of the baby boomer generation on healthcare and the healthcare system. So thanks for sticking around with us, Leanne. So we've been talking about many of the issues that have been facing the baby boomer generation. Let's now switch gears and focus a little bit more on the positive. Can you tell us what positive changes are being done to help support retirees?
Sure. So as we discussed, baby boomers have more multiple chronic health conditions, as we talked about. Obesity, heart disease, those kind of things that lead to the need for more complex health care. The positive aspect is that in anticipation of this, the healthcare field has been training people to rise to the occasion and focus on more preventative medicine. So this means that the intent of that is to have people live healthier, longer lives by taking care of themselves earlier and catching things sooner. So patients are encouraged to be more active in their daily life and become more engaged members of their healthcare team. And actually, baby boomers report feeling younger than their age, so it's a perfect time.
Great. Can you talk a little bit about what's being done to help diversify healthcare a little bit?
Yeah, so especially, I would say that the baby boomer generation, especially the younger ones, with the explosion of online and social media and everything, they're really engaging in those things. And one of the positive things is that there's lots of opportunities for them to engage in their healthcare decision making and be more involved through social media and online resources.
Great.
And then in addition to that, there's also been a move in the healthcare field toward telehealth, particularly in Montana. In a rural state like Montana, telehealth, or it's sometimes called telemedicine, is kind of a key point in reaching some of these baby boomers with preventative measures.
Okay, great. And so what is telehealth? Can you define that for us a little bit?
Yeah, so it's kind of like it sounds. Telehealth is using technology to communicate, to make decisions, to monitor healthcare. So you can use your laptop, your computer, your smartphone, your tablet, all these things that we all have to get access to different healthcare services. So there's several ways that telehealth can help. Remote access, so that you can access your personal health records. There's monitoring that can be done electronically through maybe monitoring your blood pressure, or even, so far as to monitoring pacemakers remotely. You can also access your healthcare providers. There was a time you and I couldn't email our doctor at one time, and now that's possible, and they respond, either them or the nurses. So.
And before the break, we talked a little bit about the nursing shortage and the impact that that's going to have, but what's being done to help alleviate that a little bit?
Right, so unfortunately there's no quick solution for the nursing shortage. In fact, there are lots of people that are interested, lots of students that are interested in going into nursing, and they're being turned away. Qualified applicants are being turned away from nursing schools because there are just not enough programs. So that's something that the nursing programs need to address. But in the meantime, I think healthcare providers are more than ever aware of burnout and how that impacts workers, and it can lead to, premature retirement. So they're trying to reduce the burden on the existing nurses so they can keep them happy and healthy. And then there's also community resources and even telehealth, like we talked about, that can, they're probably going to have to help fill in the gaps in the meantime.
Okay, so that all sounds pretty positive. Can you talk a little bit more about some of those positive things that are happening?
So one thing that I think is really positive in the nursing field is you do have these experienced nurses, and they have programs that bring in new nurses to work with the experienced nurses, so there's kind of an overlap, and then they're providing more opportunities for experienced nurses to to help them stay. So they want these nurses to stay and help foster the new generation of nurses. So they'll offer different flexible hours or days, or maybe even some more educational positions, something that's a little different.
Great, and you mentioned earlier community resources. Can you expand on what's being done there to help out baby boomers?
Yeah, so communities really seem to be coming together. In Montana, we have the area agencies on aging, and so I would just encourage people to contact those. Every community is different, so there are, there's programs for transportation and social services, and just kind of more of a holistic community approach to, senior centers will have healthcare people come in, and so again, if anybody's interested, just contact the Area Agency on Aging. That's great.
And we talked a little bit too about some of the housing issues. What's the positive there? What's being done to help out with that?
I think with regards to the housing, there are a lot of additions in that you see now, these communities that are cropping up, that you have, senior housing options. There's subsidy, although they aren't enough to meet the need. There's certainly subsidies available to help low-income seniors. There's these continuing care communities that provide different levels of care to seniors. So there's just a lot of options out there.
Okay, great. Well, we do have to stop and take another quick break, but coming up next, we're going to be talking about some senior living options. Stay tuned, we'll be right back.